Hello, everybody, and welcome to Planned Parenthood Illinois Action's Activist University Extra Credit Session. We are very excited to have all of you with us. My name is Michael Morgan, and I'm a program manager for advocacy and campaigns, leading the organization's Black organizing efforts. And I am here with my Black organizing fellow, Mariana Thomas. Mariana, could you give a quick intro of yourself?
Yes. Good evening, everyone. Thank you again for joining us. I'm very excited to be here tonight with you all and with the wonderful Congresswoman. I'm Mariana Thomas, as Michael has said, the Black Organizing Fellow for Planned Parenthood of Illinois. And as we get started tonight, would you all please take a moment to introduce yourselves in the chat and include your name, pronouns, and from where you are joining us tonight.
Lovely. Thank you, Mariana. So I'm very, very excited about this conversation tonight, particularly because this is our final installment of Activist University of this weekly series. And I want to shout out Adelaide Zwick, who just introduced herself in the chat. She did a fantastic job of leading this series of conversations. And we're thrilled to be joined with Congresswoman Lauren Underwood as we kick off our Women's History Month. Congresswoman, you are the youngest Black woman elected to Congress and one of 3 nurses currently serving in the House of Representatives, all of whom are Black women. So it's kismet that you are our transition from Black History Month into celebrating the struggles and the triumphs of American women. Though you need no introduction, could you please let everyone know a little bit about yourself and why you decided to co-found the Black Maternal Health Caucus?
Hi, I'm so thrilled to be with you. Thank you, Michael, for having me. I am Lauren Underwood. I represent the far western and northern suburbs outside of the city. I'm in my 2nd term in Congress, and as Michael mentioned, I'm a nurse. I decided to run for Congress after, my congressman made a promise that he later broke around protecting healthcare coverage. But my work in healthcare has been throughout my career. While I was in graduate school at Johns Hopkins University, I had a great friend. Her name was Dr. Shalon Irving. She had a PhD in sociology and gerontology. And after we finished our master's in public health, she went on to work at the Centers for Disease Control and Prevention to end health disparities. And so while I was wrapping up my service in the Obama administration and figuring out what I wanted to do next with my life, she was preparing to give birth to her first child. And she delivered a beautiful baby girl named Soleil. And then 3 weeks after her delivery, she died from complications related to her pregnancy. Now, I want to be really clear. I'm a nurse, and in my clinical education, we learned about maternal mortality and the disparities that Black women face. And I knew about it in this clinical academic sense, but it's very different going through something like this personally with someone so close to me, someone who was employed, had a doctorate, had health insurance, had done literally everything right, and we still lost her. And I was devastated. And so I knew, so she died, and then I decided to run for Congress. And I knew that if I were elected, this was an issue that I wanted to work on. So when I got sworn in, I teamed up with Congresswoman Alma Adams, who represents a community in North Carolina. And we decided to work on maternal mortality together. But since we're Congress, we gave ourselves a name. And we called ourselves the Black Maternal Health Caucus. And to my great surprise, a lot of our colleagues wanted to join us. Very quickly, the group ballooned to over 100 members. It was bipartisan. It was like the largest bipartisan caucus in the Congress last year. And And we set out to connect with stakeholders across the country, everybody from provider groups and clinicians to researchers to the leading advocates like March Dimes and great partners like Planned Parenthood and others, payers, so insurance companies, and even non-traditional stakeholders like transportation companies like Uber and Lyft, right? We were having these conversations about how to end these long-term disparities. So let's talk about data, because I love data. In the United States, Black women are 3 to 4 times more likely to die from a pregnancy-related complication than white women. In our state of Illinois, Black women are 6 times more likely to die. And for every death, there are 70 near misses. And so this is a problem that is so widespread. It is a disparity that has been in existence my entire lifetime. And I am 34 years old. And there has been no national initiative. There's no Surgeon General's report. There's been a few policies that have addressed a narrow aspect, but they had, prior to probably 2017, not seeing movement. Maybe 2018, not seeing movement in the Congress. And so we knew that we had a lot of work to do. And so the culmination of a lot of our organizing work among the stakeholder communities was the introduction of a bill called the Black Maternal Health Momnibus Act of 2020, which I introduced with Senator Kamala Harris in literally this time last year. So like a week before COVID hit, we were at the press conference together.
Thank you. That's a fantastic story, because we often hear about the adversities that people face, and you took this situation, you ran, you won twice, despite a very contentious last election, you remained the victor, and now you're doing something about it. So could you tell us a little bit about the legislation that you've put forward and what's included in this package?
Okay. So in Congress, despite there not being a lot of bills that prior to being sworn in had passed the Congress, there were some bills that have been proposed. So let's talk about solutions, because this is not a problem without a solution. So for example, Medicaid. Over 2/3 of all deliveries for Black birthing people in this country are paid for by Medicaid. And so there had been a number of bills, for example, seeking to extend postpartum Medicaid coverage to a full year postpartum. For example, Congresswoman Robin Kelly has sponsored one of those bills. We did not want to be duplicative. We wanted to fill the gaps, because solving for Medicaid solves for a lot of issues, but everybody doesn't qualify for Medicaid, right? There's still, this disparity persists even for higher income, college educated, right, insured Black birthing people. And so we wanted to comprehensively solve this problem. So the Momnibus, an original introduction was 9 bills, now we're up to 12. And so let's talk about what they do. We have one bill, the Social Determinants for Moms Act, which addresses the social determinants of health, things like housing and nutrition and transportation, which have direct links to maternal health outcomes. And as we can make these investments in their improvement, we can save lives. We have a bill called the Perinatal Workforce Act. And what that does is it invests in growing and diversifying what we call the perinatal workforce. So that's, prenatal care, people in the delivery room, postpartum lactation consultants, more midwives, more nurse midwives, more lactation consultants, more doulas, and making sure that those folks are accessible and that birthing people have a choice in who they see. It provides funding, the Momnibus provides funding for community organizations. So let's talk about these community organizations who have for decades been the only ones serving this incredibly vulnerable community, meeting birthing people and their families where they are and doing the work. These folks they obviously have tremendous knowledge and would love to scale their operations, right? And what we want to do is help them improve maternal health outcomes and promote equity, which is so exciting. We have a bill, the Protecting Moms Who Served Act, which is designed to end the disparity that we see within the VA healthcare system. So, among progressive policy circles like this one, there's often a lot of conversation about single payer healthcare. Well, the VA is a single payer healthcare system, and yet this disparity persists at the same level that we see it in the general population. We have to have targeted, focused solutions to end this crisis, and we've got to include the VA in that. That is one of our bipartisan bills within the Momnibus. And so I'm the lead sponsor on the Protecting Moms Who Served Act. I've introduced it with this guy, Congressman Gus Bilirakis from Florida. And we're working together to get that one moving through the committee. Very excited. We have a bill to improve the data collection, which is it's so messed up that we can't even right now count every maternal death accurately in this country. We have a bill, the Moms Matter Act, dealing with mental health and substance use disorders. Did you know in our state of Illinois, the #1 cause of maternal death, suicide, substance use disorders, #1. And there's that extensive disparity where Black women are 6 times as likely to die. And so we need to have, again, targeted solutions. Imagine if you are a postpartum lactating mom with a substance use disorder. Do you know where you would go? Is there a specialist in your community? There's a lot of conversation about postpartum depression, but what if it goes beyond depression? And there's some suicidality. Is there an expert? Is there a specialist in your community who is skilled, where you and your family know where to find them and have confidence that that individual will be responsive to your needs? We want that resource to exist in every community in this country. Why? To save lives. That's in the Momnibus, and it's bipartisan. Lisa Blunt Rochester, who's my colleague from Delaware, is leading that bill. We have a bill, the Justice for Incarcerated Moms Act, that Ayanna Pressley leads. Why? Because within our federal prisons, birthing people are allowed to be shackled during delivery. I mean, talk about inhumane conditions that would never be acceptable in our community environments are going on in America's jails and prisons, and it is wrong. It is wrong. And I personally think that there is a great path forward for this bill in particular, because there are a lot of Republicans, when they were in their state legislatures, that they championed this. We can see that same kind of involvement and enthusiasm at the federal level. Okay, I'm gonna go faster. Digital tools, telehealth. We are in a COVID environment. Everybody's living online right now. We need to extend the opportunity for telehealth and telemedicine to all communities. Right now, it's not available. And quite frankly, there's some research that needs to be done around whether it's an effective intervention for communities of color, people of color, in pregnancy. We have some COVID-related bills because, hello, we're in a pandemic, and we've seen the impact of Black birthing people and really just birthing people in general not being included in these vaccine trials. It is a problem not being included in the COVID treatment trials. And guess what? The biomedical evidence base has been so clear that when people of color get COVID and they are pregnant, the maternal health outcomes are abysmal, right? More likely to die. It's bad. And so we want to address it. And I teamed up with Elizabeth Warren to introduce the Maternal Pandemic Health Response Act, something like that. Last one I want to tell you about, the climate change bill. So there was a journal article that came out last summer, journal article meaning, medical journal, talking about the impact of air pollution, ozone, smog, and extreme heat on maternal health outcomes and infant health outcomes. And as soon as I saw it, I was like, we need that in the Momnibus. So we wrote the bill. These are 12 interventions that are grounded in the evidence that we know will save lives and that can pass the Congress. We're up to over 100 co-sponsors, if you can believe that. And it's only been introduced for a month, guys. So we have made tremendous progress very quickly, and we're excited to see it all the way through and get signed into law.
Thank you. And we're excited to be partners in these efforts. You spoke briefly about the doula expansion coverage, and that's actually one of our state level priorities as well, making sure that doula and home visit programs are covered under the Medicaid program, because not only are doulas essential to, folks' birth plans, they also provide critical services for gender and identity expansive communities who may not necessarily feel comfortable pursuing more traditional or conventional birth plans. So in that same vein, I love to pass it over to our fellow Mariana, who's going to ask a follow-up question.
Yes. My question for you, Congresswoman Underwood, is just last week, you voted in support of the Equality Act that would prohibit discrimination based on sexual orientation and gender identity. So I'm wondering if you could expound on how the Momnibus bill would impact Black LGBTQIA plus pregnant people.
Yes, so all of our provisions, so, in legislation, words matter, right? And definitions matter. And so there's a reason that we use words like birthing people, because we know that we have people of all genders who are delivering babies in this country, and they need to be eligible for care, and they need to have choice, and they need to have the highest quality care in a really culturally specific and sensitive environment, period. I don't care if you live in a rural community, urban community. I don't care if you want to deliver at home or at a hospital. You need to have a choice, and it needs to be with the provider that is skilled and that you trust. And so that's what the Momnibus is about. We also have been, really clear in making improvements to the Momnibus, recognizing that, yes, it's called the Black Maternal Health Momnibus Act, but when we make these changes and improve maternal health, it improves outcomes for everybody. This is not just for Black women. So our definitions have been expanded throughout the legislation to include people of color, and making sure that we are being explicit about that. Why? Because in addition to this huge disparity that we see among Black birthing people, we also see that among Indigenous birthing people. And we want to end that disparity as well. And so we have a great coalition of supporters. I appreciate that question, because oftentimes the extended LGBTQIA plus community is not included in these maternal mortality conversations. And this is about saving lives, period. And so we want to make sure that everybody's covered.
Thank you. That is, to this organization and particularly to Mariana and myself, that was something that we definitely wanted to make sure we got a chance to ask you, and it's a fabulous answer. Before I ask my next question, I'd like to let all of the participants know that we will have some time at the end to take one or two questions from the audience. So please put them in the chat box, and we will make sure that we pick one or two of them to ask. I'd like to go back a second and talk about the climate change piece. A lot of people find it difficult to make the connection between climate change and race, but the Momnibus bill specifically addresses investing in these community-based initiatives to reduce the levels of climate change-related risks to moms, pregnant people, and babies. Can you talk a little more in depth about the importance of that aspect in the future of Black pregnant people?
Okay, so let's just take it back to fundamentals. There is a concept called environmental justice. Now, why is that important? That's important because in the United States, not only do we have a history of residential segregation, this continues to present day. Look at the city of Chicago. When we think about large urban areas, there are very few that are more segregated than Chicago. And oftentimes it's the communities of color that are based in the shadows, literally, of industrial areas, meaning, near some kind of plant that has air pollutants every day, and you see it manifest in healthcare conditions. It could be respiratory conditions, it could be cancers, and we are now seeing a robust evidence base suggesting that there are, in fact, maternal health outcomes that are extremely negative for both air pollution and extreme heat. Okay, and so when we talk about climate change, we know that this is a multifactorial problem. And we know that we can solve this problem by making several types of interventions. But I think what's clear with our approach is that saying, well, if we have certain emission standards and if we, just try to solve the problem of climate change, this would just handle itself on its own. Like, no, we need to be really specific to the needs of birthing people. Why? Because it takes 9 months to have a baby, and then you have a full year postpartum period, right? And so there's a limited window where we have to be able to intervene to make sure that that birthing person and the baby are okay. And so that's really the approach I would say that this bill takes, which is saying that if we need to do something with an HVAC unit, if we need to install an air conditioner, if we need to offer direct support to a birthing person to make sure that they can combat these types of environmental exposures, we want there to be a program and a resource in order to do that.
Thank you. I wish if this were like a poetry, I feel like snapping during that answer because every single point is absolutely correct.
Yes.
Thank you.
Thank you.
So I'm going to take one question now from the audience, and it goes back to your point about vaccinations. Vaccines are everywhere in the news today. We're talking about it on every single network. Folks are talking about it at the barbershop down the street from me today.
Excellent.
Why is it critical right now to promote maternal vaccinations?
So it's actually such a good question. So we actually have 2 vaccination bills within the Momnibus. One is a general one, the Maternal Vaccination Act that Terry Sewell leads for us. Why? Because there's improvements that can be made in terms of outreach and education to pregnant people, birthing people, to make sure that they're staying on track with their vaccines and doing all they can to protect themselves and their babies. And right now, we don't have a robust federally funded program in order to do that work. Then related to COVID, we saw that in the vaccine trials, pregnant people were not included, which means that then when they got the results for the 3 vaccines we have on the market, Pfizer, Moderna, and Johnson & Johnson, there is no recommendation for pregnant people. And so you see scenarios like we've had here in Chicagoland, in my district. We had a county that told a pregnant person that she could not get a vaccine, even though she was a healthcare provider, was familiar with the evidence, and was interested in getting vaccinated to protect herself and her family. That is unacceptable. We need to have the robust evidence base in order to care for all segments of our community, right? Like it's not in the news as much, but right now there are clinical trials going on about COVID vaccine for children, because we do not have an approved COVID vaccine for children. We need to have the clinical trials around COVID vaccine for pregnant people, because we need to make sure that folks are protected. Same thing with the treatments, right? There's been less of a national conversation around COVID treatment, but you remember, especially during the Trump administration, when he had, all these theories about hydroxychloroquine or whatever, remdesivir or whatever other treatment he liked, he being Trump. We didn't have a robust evidence base around the efficacy and safety for pregnant and birthing people. And listen, we need to have it. So guess what? We wrote the bill.
Thank you. I'm so glad that we're recording this, because these are just like such stellar answers that it's giving us so much evergreen content. I'd like to take it back to what I find one of the more engaging parts. It's all engaging, but when I see innovative payment models, my eyes bright up.
Okay.
I mean, we all know that healthcare costs are a really big concern for most Americans, particularly Black and poor ones. Compounded with the cost of childbirth and follow-up care, they can often be insurmountable. Can you speak a little more to the legislation's position on these innovative payment models?
Yes. Okay. So there is a traditional payment model in this country that says it's called fee for service. You walk in, you get something done, they pay for it. Doesn't matter what the outcomes are. So when you're paying for poor quality care, it's very difficult to incentivize those providers to improve the quality of care if you are not creating an incentive. And so these innovative payment models are to create a financial incentive for the healthcare systems that we all frequent to deliver higher quality care. period. Now, there's a variety of innovative payment models that have been tested throughout the years, but they have not necessarily all focused on maternity care. Meanwhile, we all know that in many communities, maternity care can be extremely litigious, right? Meaning lots of lawsuits, that there are obviously negative birth outcomes resulting in death, right? That's what we're here for. And we, again, in a comprehensive way, are trying to make changes to our healthcare system. Why? To save lives. That is what this bill is about in the most direct way. But it's reliant on some other provisions passing. So for example, we need to clean up the data collection, because you can't say that we're only going to pay a healthcare system, which would be a hospital or maybe a birthing center, a certain amount of money if there's some inconsistencies on how we're qualifying a negative birth outcome or what counts as a maternal related death, right? Because we're talking about a full year postpartum. And so if somebody's death gets coded and it's not explicitly mentioned that there was a linkage to that pregnancy or there's a linkage to that delivery, sometimes it doesn't get looped in with the data set, but there was a linkage, but maybe that coroner didn't know, or that county level official who's in charge of the death records didn't know. Does that make sense? And so within the Momnibus, I would think of these as variations on a theme. So my parents growing up were very, very, very emphatic that I take piano lessons. And one of the things that we learned in piano lessons is that if you have a theme, you can like color outside the lines a little bit and create like this beautiful symphony or musical by having variations on that theme. That's how the Momnibus is. We're there to save lives. There's all these different areas that we can do it, but they're interdependent on one another. And when they come together, it makes a beautiful piece of music.
Thank you for that. And I believe Mariana has a really quick follow-up to that question.
Okay.
Hi again,
Hi.
Congresswoman. There's a follow-up question in the chat about a note about women who suffer miscarriages can be left with enormous bills that aren't covered by their private health insurance because they no longer qualify for maternal care. Is this a loophole addressed by the Momnibus bill?
You know, I would probably need more information to be able to be completely responsive. And generally, the Momnibus is designed to prevent maternal death and not to explicitly address some of the other generally maternal health outcomes like miscarriage or preterm birth even, right? And we only have one or two bills that are dealing with like infant mortality. And so would be happy to get ideas and to discuss, because this is an area of probably unmet need. But we've been really laser focused on addressing maternal death and severe morbidity, which is the near misses, the 70 near misses for every death.
Thank you. Because this bill is aimed at protecting lives and taking care of people, yet it has what some may consider a polarizing name, you've still managed, like you said, to garner an incredible amount of support. Can you give us a little bit of insight into what that process has been for really working across the aisle to get this passed and get it through?
You mean polarizing because it calls out Black maternal health? Is that what you mean?
Yes.
Okay. So, you know, I believe you have to tell the truth. And there are uncomfortable truths in our society. And one of those uncomfortable truths is for decades, it has been somehow acceptable for one group of people to continue to die delivering babies in this country. Now, I'm a clinician, a nurse, and in my training, we were told like, oh, you know, there's just something about Black women where they're more likely to die. No, there is nothing wrong with us. Nothing wrong with us. We are in a racist healthcare system, right? Society treats us differently when we enter our healthcare system, and the manifestation means that some of us die at 3 to 4 times the rate of our white counterparts. That's what this is about. It is undeniable And we have been able to make connections across the aisle because we found that a lot of people recognize that we should be able to solve this problem in 2021 in the richest nation on earth. Infant mortality, just as a parallel, is one of these measures that researchers around the world use to measure the health of a population, with the idea that a healthy society should be able to keep its babies alive to their first birthday. And as a measure of an unhealthy society, right, if you see tons of babies dying from whatever cause in that first year of life, I would argue that this is a similar metric. There's something in our society that is deeply rooted and unhealthy that this has been allowed to go on for so long. And so in my experience, the Republicans who are members of our caucus, the Republicans who are co-sponsors of our legislation, and listen, there's people in the caucus that don't co-sponsor legislation and people who co-sponsor the legislation that aren't in the caucus. We'll take you no matter what flavor you want to interact with us, okay? Let's just be clear with that. They have some deeply personal reasons for wanting to do it. But then let's be real, there's also an electoral component. These folks run for re-election every 2 years. And when you look particularly at the South, where there are extreme disparities, because this is one where it's very geographically based, right? They got to go to Black churches. They got Black constituencies that they got to talk to. And oftentimes they don't have anything to say. And they know, like we know, who goes and votes in this country. And so, you know, you can be a cynic. Fine. We can save lives and win elections. That sounds fine to me.
That's our new slogan. We can save lives and win elections right there.
Good. That's what I'm about.
And that takes me, this takes me to our final question, which is a perfect segue. And I'd like to talk about former Senator Kamala Harris and now Vice President Kamala Harris and her role in the legislation, and how can her new really beefed up role get us through this?
Okay, so let me just be clear. I love Vice President Harris. And it has been my complete honor to work with her on this issue. So she was our Senate lead last year. Unfortunately, as I shared really casually before we got started, we introduced the Momnibus about a week before everything shut down due to COVID. I think it was like March 7th. Today's March 3rd, right? So we're coming up on our 1-year Momnibus anniversary. And she has been such a dynamic leader on this issue. She's worked with everybody who's worked on maternal health stuff. She's been in it. And so I would say we have an excellent working relationship. We were successful throughout the course of 2020 of getting ending maternal mortality, like this crisis, into the DNC platform. We did that. We got it as part of Joe Biden's platform. And we know that the Biden-Harris administration remains interested and committed to taking action. So the question then becomes, you know, on what timeline? What does taking action look like? But then there's been these wins already. So in the COVID package that folks are debating right now in the Senate, we have included the postpartum Medicaid expansion. So remember when I told you that Robin Kelly had authored this bill to expand Medicaid coverage? Here's why this is important. So if you want to do one thing to save moms' lives in this country, you got to fix Medicaid. Statutory Medicaid, so not like Illinois, which is expanded Medicaid, but for those states that didn't, the coverage cuts off 60 days postpartum. And so for those states that didn't expand Medicaid, you're leaving postpartum people out hanging when they are still at extreme risk of dying. So we fixed that with the support of the Biden-Harris administration. But we know that they are also committed to doing other things. And that's where the Momnibus comes in. So I'm just so excited about the momentum that we built, the possibilities that lie ahead, the lives that we're going to save, and really the people who will feel seen in the work, right? I get the opportunity to talk about this issue a lot. And one of the things that I always say is, like, within our community, this is something where it is always felt lonely. But so many of us know somebody, our sister, our neighbor, our church member, you know, the girl around the corner, our sorority sister, our best friend, our niece, our daughter, our aunts, right? We all know somebody who's either died or have had these extremely horrific, not a difficult pregnancy, like horrific, near miss, I almost died. Everyone from Beyonce and Serena Williams to the GOAT, Allison Felix, amazing Olympian, have women in excellent health, have done all the resources in the world, still have that same testimony, matching the experiences of birthing people around the country. And it's something that it is not just us, we are not alone, and it is unacceptable, and we want to solve this problem.
And we are right there with you, supporting
yes,
all
Parenthood,
of these efforts. We are right here. Congresswoman, thank you so much for joining us tonight for this quick chat. And thank you to everybody who participated in this. This is our final Activist University series. So thank you to the organization, to Addie, Mariana, and everyone who helped put this together. We encourage you all to sign up for the Black Organizing Program that Mariana has posted in the chat, and we'll be uploading future guidance on how best to support the Momnibus legislation moving forward. Congresswoman, again, thank you so much for taking the time to chat with us, and we hope to partner again with you soon.
Thank you for having me. Take good care of yourselves, everybody.
Thank you so much. See you, everyone.